Hello, welcome to Complete Chiropractic Healthcare on the website of Dr. Greg Arnold, www.pitchingdoc.com. Today we're going to be discussing my December 12th, 2011 newsletter, what I call the Super 6 Pitching Throwing Concepts to Prevent Injury. If you look below the date, there's a hyperlink that you can click on, and that'll pull up a PDF, which sometimes is easier to read. The first thing we're going to talk about is learning the changeup before the curveball. The biggest misconception about the curveball is that if you don't snap your wrist, you won't hurt your elbow. And that is something that has been disproved for years, yet is still being taught by coaches all over the place. And this comes from a 2008 study from the American Journal of Sports Medicine that looked at the difference in arm stress between curveballs, changeups, and fastballs. And what they found that there was an increased risk of injury from the curveball, but it wasn't because of not snapping the wrist, or snapping the wrist. Rather, what it was coming from was inconsistent mechanics, and it actually led them to conclude that the curveball may not be more potentially harmful than the fastball. And the issue is just consistency of mechanics. At this young age, when we're dealing with young pitchers, they're so inconsistent with their mechanics. That's why it's advisable that they not throw curveballs. It's not about this not snapping the wrist. It's about having their body in improper position with throwing the baseball, which creates a bad release point, which increases overall elbow stress. So now, until that point, until they can deliver consistent mechanics, you want them to learn the changeup. And if you want to learn about the changeup, you can subscribe to my baseball video library. There's a link at the top of my website, and if you look down, you can watch a 1-minute video that talks about all the different questions that I answer, throwing drills, long toss, exercises for injury prevention, what to do between pitching starts. It's a very good resource for you, and if you want to subscribe, you just go down there and click on that hyperlink. So if we get to the second one, the other really important concept is teaching young pitchers and throwers to control their glove. And just as we teach kids to control their hands when they hit to be nice and steady, we have to control the glove when we throw. And what I continuously stress is always keeping the glove chest high when we throw the ball. You look at Trevor Hoffman here, glove chest high halfway. You look at Randy Johnson at ball release, and also St. Louis pitcher, I believe his last name is Reyes, at ball release. Keeping the glove under control, not tucking the glove. When we teach kids to tuck the glove, we actually cause the glove to move more. And just as more movement in hitting results in a more consistent swing, more movement in throwing with the glove results in a more inconsistent delivery. Point number 3 is no balance point during the leg. Excuse me, point number 4. No balance point during the leg kick. And the way that I try to teach this is we talk about what we do when we teach kids in the field to throw. When we see a shortstop get a ground ball, we don't teach them to wait back once they get it. As soon as they get it, we teach them to move their hips, build momentum, be athletic. And this is actually disproven. The whole balance point issue was disproven in a study, I believe back in 2008. Here's the study. It's called The Relationship Between Balance and Pitching Error in College Baseball Pitchers, and they showed that pitchers with balance points actually had less velocity and more accuracy problems, and they actually related it to having more head movement. When a pitcher has more head movement during the delivery, it creates more body problems. So the concept that we do is use your hips. As soon as that foot gets off the ground, you have to use your momentum with your hips. And what's been shown that having a balance point ruins your ability to build momentum, be athletic, and have better timing. Great quote from John Wooden: be quick, but don't hurry. Point number 3, the best exercise that I've ever seen for shoulder injury, for shoulder health, is weighted jump rope. Not regular jump rope, but weighted jump rope. I'm not a big fan of the rubber tubing, of using the tubing bands for the kids to do exercises. They're boring. They're not very functional if you're not post-surgery. Just in general, kids don't do them properly. So the reason why the weighted jump rope is so important is that they did a study back in 2010, and using the weighted jump rope for a total of 5 minutes a day, 3 1-minute sets divided by 2 1-minute rest periods, increased the strength of the rotator cuff by 55%. And the reason why this is so important is because another study showed that weakness in that specific muscle is known to increase arm injury risk in pitchers. So the weighted jump rope strengthens the exact muscle in the shoulder that is found to be weak in pitchers who get injured. So to me, there's no question about what is the best shoulder exercise, really for anybody, but especially throwers. Concept number 2, throw more, pitch less. Hitting, when we look at hitting is all about timing. Kids will come in and they'll hit 3-4 times a week in the cages or in lessons. But when you talk to pitchers, they'll be lucky if they throw 2, maybe even 3 times a week, other than the days that they pitch. And when you don't throw enough, you lose your timing. And when you don't have good timing, then you're going to have poor mechanics, poor arm mechanics equals increased arm stress. So you have to learn how to throw before you can learn how to pitch. So kids today, they pitch too much, they don't throw enough. If you want to pitch well, you have to throw more between your starts. And then finally, no fall ball. The American Sports Medicine Institute cites year-round injury. Year-round baseball is one of the biggest risk factors for injury. And if you can go to their website, asmi.org, they have a position statement for Tommy John surgery, and they have risk factors for pitchers. And here it is: pitching on multiple teams, pitching year-round, playing catcher when not pitching, poor pitching mechanics, and poor physical conditioning. All of these things come together to have a perfect storm to cause arm injuries. And what happens in fall ball is kids, again, they throw much less than they pitch. Most of them only throw once a week, and it's usually on the day they pitch. And that's when we see all these sore arms. So I hope these 6 concepts make sense. If you have any questions, you can go to my website, www.pitchingdoc.com. Send me an email at pitchingdoc@msn.com. Thank you.